health is often overlooked, yet it is interconnected with many systemic health issues, including heart disease, diabetes, and even pregnancy complications. Oral health matters, the importance of dental health. Tonight, On Call with the Prairie Doc. Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you, with care and coverage. Hello possibility. Hello healthy. Hello life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Sanford Health, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health.
Good evening and welcome to On Call with the Prairie Doc. I'm Alex Bisson, your volunteer Prairie Doc host for this evening's program. Tonight we are discussing and answering your dental questions throughout the show. Good oral health is crucial not only for maintaining a bright smile but also for overall well-being. It plays a vital role in preventing a range of health issues including gum disease, tooth decay, and even more serious conditions such as cardiovascular disease and diabetes. Regular dental checkups and preventive care are essential components of a comprehensive approach to health, reinforcing the idea that oral health is an integral part of our overall health and quality of life. In the studio this evening are Dr. Nathan Hilbrands from Brookings Family Dentistry and Dr. Ryan VanLaecken from VanLaecken Orthodontics. Thank you both for being here with us tonight.
Thanks for having me.
Now, Dr. Hilbrands, I'll start with you. Can you give us a little bit about your background and then what led you to the field of dentistry?
Yeah, so I went to SDSU for undergrad, kind of was originally pre-pharmacy, found out there just wasn't a lot of patient interaction with that, so I ended up in between medical and dental, talked to some of our family friends. They all kind of pushed me towards dental a little bit just for quality of life, being able to spend time with your family. Yeah. Definitely made the right decision.
Wonderful. Thank you for being here tonight. Yeah. And Dr. VanLaecken, what about you? Tell us a little bit about your background.
Similar story. I always wanted to do something in the health field. My mother was a surgical nurse, so I had a little bit of experience with the medical field, and although I enjoyed it, I did see that it did sometimes affect family life and things like that, so I thought that I could still serve and treat people, but be able to spend a little bit more time with my family as well. So that's kind of why I gravitated towards dental rather than medical.
Well, thank you both for being here and spending some time answering these important questions about dentistry. And let's just get right into the important discussion for this evening. We've already got some questions rolling in for some of our viewers. So I will start, and answering these questions doesn't matter which one of you, if you want to go back and forth, doesn't matter to me. But we'll start with a caller from Mitchell asking, why is a regular dental checkup so important, and how often do you recommend patients come in for a visit?
I'll defer to Nathan.
All right, so we recommend every 6 months for the majority of our patients. There's some that have other bone loss issues, periodontal issues. Yeah. Sometimes those are on a little shorter recall, 3 months, 4 months sometimes. Why is it so important? The biggest thing in my mind is just being able to catch stuff while it's small. Sometimes people can have a little cavity, and over 6 months, a year, sometimes that cavity can grow. Yeah. And as far as even saving people money, it's a lot easier to treat a small filling versus some cavity that's grown into that nerve where it needs a root canal. And as far as cost goes, it goes up a little bit at that point. So
easier to treat it when it's
smaller.
Early. Yeah, absolutely. Dr. VanLaecken, so there's one in here, there's a question from Facebook that asks, my son was told that he needs braces. Are there different types of braces? If so, what determines what type of braces that you should get or can get?
It really depends on the complexity of the occlusion. So depending on if he's adolescent or how young he is, it'll determine. But Nowadays, usually the gold standard is still the brackets that we place on the teeth with the wires, but Invisalign has become more and more, I'd say, proficient at treating cases. So I think there's options. In our office, we would look at the particular occlusion and then make a recommendation that we thought was best for him. But I think there'll be options for them. I don't think that there necessarily will be pigeonholed into just one.
Okay. I think this is maybe a good question that maybe I should have started with off the top. It's actually from an email. It is, what is the difference between a dentist and an orthodontist?
Well, a dentist, little bit of everything. He'll do a little bit of everything. You'll go to him for your checkups. An orthodontist specializes in the alignment of the teeth and the occlusion. Now, to be an orthodontist, you had to have gone through dental school. So I am a dentist as well, but then I just went on to additional training.
Okay. Great answer, thank you. Nate, we'll have you answer this one. It's from Facebook. What are you checking for in those yearly or every 6 months or so exams besides just cavities? What else are you looking for?
We're looking at the bone health, the gum health. A lot of people have recession where the gums have receded a little bit. Also checking for oral cancer each time that they come in, just to try to catch stuff while it's small. We're looking at occlusion as far as orthodontics goes. Sometimes people have just the way their bite aligns, they're causing trauma on teeth that could be prevented with some movement that the orthodontist could do.
Okay. What is one of the biggest misconceptions about oral health that you encounter? And maybe let's have both of you answer this, if there's different ones you encounter in orthodontia versus general dentistry.
For me, it probably would be that orthodontics is cosmetic alone. I would agree with Nate, there are some issues. Now what we do in orthodontics is definitely cosmetic, but there are some underlying occlusions that can cause some significant issues if left untreated. And it's usually a slow process, but as you age and start to become middle age, that's when they can start to really manifest themselves. So I think, yes, we do like to make the smiles look wonderful, but there is some functionality to the bite that we definitely want to address as well.
Absolutely.
Kind of playing off what Ryan said, I think there's kind of a misconception that, you know, as far as taking care of the teeth, sometimes you can do everything right, but they can still get cavities. I think diet plays a big role in people's oral hygiene. Is definitely important, but a lot of people, you know, they tell us they brush twice a day, floss once a day, but the contributing factor is their diet, where we tend to see a lot of cavities with people's.
Okay. A caller asks, I went to the dentist and I was told that I have a cavity, but I have not felt any pain. How do I have a cavity, but I don't have pain associated with the cavity? That's a good question.
It is.
Yeah.
I'll defer to Nate as well. He treats that
So,
than I do.
That's a very common thing that we see, and a lot of that's catching, like we talked about, catching something while it's small.
Yeah.
A lot of times that cavity's not going to hurt till it's close to the nerve. And when it gets to that point, you know, it's a possibility that tooth needs a root canal where you got to go take the nerve out of the tooth. But yeah, very common that we see. We also see people that come in with pain, and it's not cavities. Sometimes they'll have that root receding, and they'll have, a lot of times that sensitive toothpaste will make a big difference on those people. So just because it's not painful does not mean that there's not a cavity there, for sure.
I would just add that if you have a cavity and it isn't hurting you, that is actually a good thing.
Yeah.
It means that it's probably not significantly large. When you start getting pain with a cavity, it means that it's pretty involved.
You mentioned something about toothpaste, and there's a good question. It's a caller from Sioux Falls asking, with so many toothpaste on the market promising whiter teeth, gum disease prevention, maybe sensitivity prevention, how does someone choose? How does a patient choose, or how do you advocate that they choose a toothpaste?
Some of them symptom-based, so a lot of people that I see that have recession, we've had very good success with sensitive toothpaste making a big difference for those people. On the side note, you said whitening toothpaste.
Yeah.
I'm against whitening toothpaste. I feel like we just see probably 3-4 people coming a week that switch to whitening toothpaste, and they went from not having any sensitivity to having a lot of sensitivity, and it just and they switch back to regular toothpaste or sensitive, and all that sensitivity clears back up.
Sure.
And it doesn't really whiten very well.
Right.
So
I would say, with all the different toothpaste on the market now, there's some homeopathic or organic. If I was to recommend, I would just tell people to look at the label and look for the seal of the American Dental Association.
Sure.
That means the toothpaste has been researched, it's been studied, it's had to go through some testing, so it's going to be a safe toothpaste for you.
Yeah. This is a great question from email, switching gears a little bit. It's, can the doctors talk about oral appliances for sleep apnea? They're asking, are they worth it, and how do they actually help?
They do help. They won't make as big a difference as, say, the CPAP machine, where it has the forced air. But for some people like myself, I struggle with the CPAP. So really what you're trying to do is you're trying to open the airway. So an oral appliance will posture the lower jaw forward to try to open the airway while you sleep, so that it just gives you a better chance of intake of oxygen. So I think there is some research out there that shows that, yes, they are beneficial, and they may help, but in severe cases of sleep apnea, I'm not sure that you're going to get the relief that you want from an oral appliance alone.
The sleep apnea appliances, you make them in your practices. Is it something that you can order online, or should you see a dentist or a medical doctor to have one of those made or purchase one?
I think seeing a medical doctor just for the diagnosis as far as the sleep apnea is important. I also have sleep apnea, like Ryan, and I just cannot wear the CPAP.
Yeah.
And I think that's a big role where the sleep appliance can help. Like Ryan said, it's not as good as the CPAP, but I just cannot wear it. I struggle. I take it off at night. I don't know to put it back on.
Yeah.
So I wear a sleep appliance. Is it, like I said, probably not as good as a CPAP, but I think it does help open my airway. Also helps with snoring.
Right.
Yeah.
And technically, you need a diagnosis from a medical doctor to have someone make you an oral appliance. I can't just bring somebody into the clinic and say, you've got sleep apnea, I'm going to make you appliance. I don't have the certification to make that diagnosis, so I have to receive something from a medical doctor before I am allowed to treat that with an appliance.
We'll stay on a similar gear there. This is a question from email. It says, I grind my teeth at night and it was recommended to get a night guard. Is this something that would help, and why will my insurance, or why does my insurance maybe not pay for something like that? Is there something over the counter that could work? I know there's a lot of questions in there, but maybe let's just start with grinding teeth at night. Does a night guard help with that?
Absolutely.
Okay.
Yes. Yeah, it makes a big difference. Kind of spreads those forces. Also provides a level between your two teeth, so patients aren't wearing down their natural dentition. As far as, what was your second part of that?
Well, it was about insurance. Insurance doesn't typically cover those.
Yeah, I wish I knew why they didn't cover them. We struggle with that. It makes a huge difference in people's lives that brucks and don't get a good night's sleep or have jaw pain. Probably 80% of bruxers out there would gain relief from just a bruxism appliance. The other 20 may need a little bit more involved treatment, but for the ones that grind their teeth, I think it would make a huge difference for them. And we've gone around with the insurance companies, and to be perfectly honest, I'm not sure why that isn't a covered benefit. We really wish it was.
Recently, we've been starting to see a little bit more insurance reimbursement on that. But that you were asking, office versus, are there other options?
Over the counter, even.
Over the counter. Walmart sells like a boil and bite. The biggest thing with the boil and bite ones, it's very difficult to get a good form fit of your mouth.
Yeah.
So a lot of times people actually will clench more to try to keep it in place.
Okay.
And the soft, I'm not a big fan of the soft appliances over the counter, just from the standpoint that a lot of times when we put something in our mouth, especially when we're sleeping, it kind of triggers us to actually chew more so it can actually promote more quenching and grinding if something's in our mouth as opposed to a hard surface. So any type of a bruxism appliance, my recommendation would be to make sure that it's a hard appliance.
Okay. We will go a totally different direction and answer this viewer's question from Facebook. They're asking how long does a crown or bridge typically last?
Insurance covers that stuff every 5 years. I see a number of them that have been in there 15, 20, 30 years.
Yeah.
Absolutely.
The biggest component, I think, is home care, taking care of it. The diet, like we talked about earlier, but home care is a big one.
Absolutely.
There's another question here from email. Can the doctors talk a little bit about gum recession? And what are some of the reasons why our gums recede and we face gum recession?
Yeah, so our big thing, the biggest causes I see are people that brush with a really hard toothbrush or brush really hard when they're brushing. I always recommend extra soft toothbrush. The other thing I see is the clenching and the grinding can also cause a lot of recession, where that night guard can help protect some from that. But brushing, I would say those are the two biggest ones that I see in our practice.
And just to clarify, is there any way to reverse gum recession once it starts?
Not reverse it, but there is, you can do like tissue grafting would be an option, usually at a periodontist.
Yeah, you can't grow your tissue back, unfortunately.
Yeah, right. Okay. Let's get into this question about an electric toothbrush. You were mentioning with gum recession. First of all, the question says, a caller from Madison is asking, is it better to use an electric toothbrush versus a manual toothbrush? And they say, sometimes my teeth are sensitive and I don't love to use my electric toothbrush. Why could that be?
I think both can be done very well. I think the biggest thing with the electric is just kind of letting it go around. Sometimes people still want to scrub with that electric. Even with a conventional toothbrush, just nice soft circles kind of all the way around the teeth.
Yeah.
Where we get in trouble is when we really start to scrub. So with the electric, and some of the new electric ones actually have like a pressure monitor on them where it'll tell you if you're putting too much pressure.
Yeah, those are cool.
I think anybody that maybe has a little bit of dexterity issue, or as we get older, an electric toothbrush may work a little bit better for them. As far as sensitivity, I guess my thought would be possibly one, if you're sensitive, you may be brushing too hard, or I would recommend that maybe you brush with warm water if you're using cold water.
Okay, thank you. And fluoride is a natural mineral. Its primary function is to strengthen the enamel. Tara Faber, a dental hygienist at Brookings Dental Clinic, explains fluoride's role in our dental health.
When you come to the dentist and you have your cleanings and you have your exams, the most important thing that we do is we will put a fluoride varnish on your teeth at the end of the appointment, and that fluoride varnish is very beneficial to strengthen your enamel and prevent cavities.
Faber says they recommend everyone to use fluoride every day.
With kids, really the ADA, or American Dental Association, recommends fluoride use to start, honestly, as soon as you get your first tooth in. I usually just say use like the size of a grain of rice, or we call it a smear, just a really small amount on the toothbrush. Make sure you the parent, are brushing it on, and then obviously they can't really spit very well at a young age, so the amount that you use is so minimal, it's not going to cause any harm, but you're still getting the effects of the fluoride on the teeth.
Fluoride is often in our water.
The easiest way and a really cost-effective way to allow people exposure to fluoride is to put a very monitored amount in our public drinking water. That way it's always controlled, it's always monitored, you're not getting too much fluoride, but it's just a great way for everyone to have the chance to get fluoride in their system.
She adds the best way to get fluoride is with toothpaste.
And the thing I always tell people about toothpaste, a kind of a common misconception, is no matter what you're using for toothpaste, you always want to brush, you're going to spit it out, but don't rinse. Don't rinse with water, don't swish, just leave the fluoride on your teeth, and that's how you're going to get the max benefits.
great information there about how fluoride affects our dental health every day, and we in the broadcast have discussed a few other things affecting dental health, and one thing I really want to discuss is sugar. How does sugar play such an important role in our teeth and in our oral health?
Well, I guess it depends on how in depth we want to go, but really what it comes down to is the bacteria on our teeth that break down the enamel and cause cavities. Basically, what they do is they ingest the sugar. That's really the only component that they can use to break down, and as they break down, they produce an acid, and that's what causes the demineralization and causes the cavity. So theoretically, if somebody never ate sugar in their life, they probably would never get a cavity, but we know that's just impossible. It just isn't going to happen. But sugar is a big component, probably the component when it comes to dental decay.
If you just have to have that slice of chocolate cake at the birthday party, is there anything you can do afterwards?
If you don't have a toothbrush, then swish your mouth with water. Try to get any debris that seems to be sitting on the teeth.
Okay.
Try to get that off the teeth.
And I know sometimes people try to space out like their snack. They'll have, I'm just going to have a bite every so often.
Mm-hmm.
You're actually much better off just eating the whole thing all at once, because each time you take that bite, that process of acidification is still continuing.
Yeah.
So if you take it all at once, it's actually better than
And that holds true for maybe sipping on
a pop
during
all
the day. Or
Yep,
whatever.
absolutely.
Yeah,
Yep.
absolutely.
Yeah, we see that in the ortho field significantly. Individuals that drink a lot of the sugar pop, they get the white spots that we talk about, or the cavities right by the gum line. The sugar tends to just sit right by the gum line where it meets the tooth, and we see unfortunately a lot of issues with that.
Yeah. I am going to go back to fluoride for just a minute. A caller from Rapid City is asking, what is the difference between the fluoride treatments that a dentist provides versus the fluoride wash every day? I'm wondering if they're saying the fluoride toothpaste perhaps every day. Mm-hmm.
Concentration. It's a higher concentration of fluoride. Yeah.
And you typically...
And usually, like the ones we use as a varnish at our office, it tends to stick on the teeth for longer duration too. Yeah.
Do you typically apply that every 6 months when
every
the patient
6
comes
months,
in?
usually up to the 18th or 19th birthday, so up till when they're 18 is when insurance usually stops the cover. We do have some adults that still want to do it.
Right. We'll apply varnish in the orthodontic office anytime we might start to see some initial stages of the demineralization, where we start to see the white spots on the teeth start.
Yeah.
And we'll do that maybe every other appointment, which is probably maybe once every 16 to 20 weeks.
A caller is asking, I had braces in my youth, but I didn't wear the braces long enough, or perhaps their teeth have shifted, and now my dentist is recommending having braces again. Are my only option for braces metal braces?
No, it depends on the severity, but many times when it's a retreat, you probably would be a candidate for Invisalign. It just depends on the complexity of the case. A lot of times we'll see people come in, and the biggest reason I see teeth move is probably not wearing retainers. I'm guilty of that myself, but if you don't want your teeth to move after orthodontics, you really need to wear those retainers. It's kind of a lifetime deal, where you may not wear them every night, but you need to wear them consistently. 2 to 3 nights a week, or if they're tight, wear them more frequently, because no matter what we try, our teeth are always going to move as we get older. There's been numerous research trying to figure out a way to prevent teeth from moving, but we can't. So retainers are really the only way to maintain your occlusion and your bite.
A follow-up question about those retainers. Do you typically just do removable retainers, or do you place permanent retainers as well?
Generally, I'll put permanent retainers on the lower, unless the patient seems to struggle with their hygiene. And the reason I put them on the lower is the lower front teeth are the most likely teeth to move as we get older. That's where we'll see the most crowding. So we'll put one down there. We have put some permanent retainers on the upper as well, if people request it, but to answer your question, usually it's a removable retainer on top, and then you can go with a permanent fixed retainer on the bottom.
Okay. This is a question from email. My child does not like to go to the dentist. How do I encourage him or her to go and not be nervous while they are there? Our children struggle with this as well, so any advice would be great.
I think some of it's just finding the right environment for your child. I mean, I think a lot of offices do really well with kids, try to make it enjoyable. I know at our office, they get to watch TV, they get a toy at the end. Just try to make it fun for kids. And I mean, as far as getting them in the office, I think it's just finding the right fit for your kid. And every kid's a little different, where one office might be not the right fit.
Right.
Some of that's kind of trying different offices.
I think it goes back to what Nate said too. I'm a firm believer in every 6 months, and I think if you bring your children in for routine exams, they get more comfortable. You know, it's tough to come to the dentist if the only time your child's coming when they have a toothache and you have to do something a little bit invasive.
Right.
So if you can get them on a habit of coming to see the dentist, and it's a checkup and a cleaning, and they walk out 30 minutes and really haven't had to undergo anything too intense, that just kind of reinforces the visit, and I think that plays a big part.
Speaking about children going to the dentist, when should they come for their first visit?
So 1-year-old or 6 months after their first tooth is kind of what we do. And a lot of that first visit's just parent education. Obviously, we're looking in the mouth to see kind of development. Some even 1-2-year-olds can already have cavities. Sometimes that's related to taking a bottle to bed. Juice is usually a tough one for kids' teeth. But yeah, like Ryan was saying, even those one, you know, when they're 1, 1.5, 2, 2.5 even, some of those visits, they're pretty short, they're pretty quick. The kid's probably gonna fuss. And some of that's just trying to, the more the parent works with the kid too at home, we see parents that they come in and they can't brush their own kids' teeth at home. So I think it's just getting the kid used to, and naturally kids are a little orally defensive. So just getting the kid used to having stuff in their mouth, because obviously if the parent struggles with it at home, it's really tough to have a stranger come in and do it too.
Orthodontically, we like to see patients before they turn 7. It's not that we're going to probably do anything. We just like to evaluate to see if there's any issues that maybe we need to jump in and address, check to see if there's any missing permanent teeth or any issues like that. So. You know, I think the American Association of Orthodontists recommends to see an orthodontist before your child's 7th birthday, and I would agree with that.
Okay. From email, why do I have to have x-rays during my appointment?
You don't have to. But the biggest thing, I mean, on our end, we're out once a year, we try to get x-rays. We don't always do full mouth x-rays every year, but it's nice to have bite wings. If you see something going on, take an anterior x-ray. It's just to be able to catch stuff while it's small. And honestly, I'm pretty conservative, so sometimes, and it's nice to take them each year, because sometimes you can look at the x-ray from the year before. And if I look at a spot where we have a little bit of starter breakdown, it looks exactly the same the next year, I'm not gonna put a filling in that tooth. But if you see some change in that, then you can still catch that filling or that cavity while it's small.
Yeah, generally, we are gonna take x-rays. And the reason we do that is we need to see the underlying condition of the mouth, because we're actually going to be moving teeth and changing positions, and there's a chance that we could make things worse if there's something that's undiagnosed going on. And we just don't want to see anybody lose a tooth because of that. So generally speaking, in our office, if we're going to do some type of complex treatment, we're going to require x-rays, or we'll probably just say that we can't treat you.
And I know with orthodontia and with dentistry as well, they do a lot more nowadays with a 3D scan. How does that specifically help in diagnosing a patient or putting together a treatment plan for their orthodontia care?
Well, a 3D scan, I think, is a little bit more accurate. It gives me a better view than just looking in the mouth itself. I get a better idea of how the bite fits together. You know, I can turn it in different directions and look at it from different views where I normally can't when I'm looking clinically. So, and the 3D scan has allowed us not only in diagnosis but in appliances too. We're able to make appliances that fit better. They even are designing the individual braces for a specific tooth in each patient's mouth to fit it just right and move the tooth accordingly. So the technology that is out there now is amazing.
Yeah, on our end, I guess ours would be more towards root canals, where you can see different canals, sometimes that are missed when you're looking at a 2-dimensional image. Sometimes wisdom teeth when they're close to the nerve space there would be on.
I think this is a good follow-up question to that, the 3D scanning. A caller is asking, what are the top 3 or the top few best technical advancements in dental techniques within the past 5 years?
Dental techniques.
I think 3D scanning would probably be on that
big
list.
one.
Yeah.
I think in the future, 3D printing is going to become a
We
bigger part of.
actually had a question about 3D print too.
For orthodontics, I would probably say the scanner has been out for probably, probably almost 20 years now, but now we're starting to do some 3D printing of appliances, 3D printing of brackets. So I'd say 3D is going to become a big player in the ortho field going forward.
And we kind of see AI everywhere too. How does AI impact treatment and care?
Yeah, it's going to be
Is it already, or is
it? There's starting to be some software companies that are doing it. In my mind, I think you're going to be able to see some stuff better. I think it's still going to come down to doctors or dentists' judgment, because I feel like you look at a picture and they mark all these little cavities. And in my mind, are you helping the patient by drilling out a little small space and creating a larger area of potential breakdown around a filling? So I think hopefully.
Yeah, I would agree. I think it's going to maybe help a little bit, seeing things that maybe we wouldn't normally see in diagnosis, but I think it still comes down to the experience and the training of the dentist when it really comes down to what needs to be treated and what doesn't.
Okay. This is a question from email. It's, should I be doing anything different for brushing or dental care? Sounds like this individual is in their 70s, so as we get older, is there anything that we should change with our habits for oral care?
I think sometimes, like we talked about earlier, the dexterity thing. So there are special toothbrushes that sometimes have a wider handle that the patient can use a little bit better as far as brushing. Usually when we're getting in our 70s, 80s, 90s, I would definitely be using a fluoride toothpaste. We're going to usually have more of the root that's exposed, and those root areas are going to be a lot more prone to getting cavities on them versus the enamel layer of the tooth.
Yeah.
And I would say for older patients as well, sometimes you'll get decreased saliva flow, so they can struggle a little bit with dry mouth. So I'd encourage you that if you are struggling with a little bit of a dry mouth, definitely consult with your dentist the next time you're in, and they can probably give you some suggestions, because a dry mouth environment can actually breed a little bit more bacteria and lead to problems as well.
And certain medications can
absolutely
impact that as well. So a caller is asking, my son has trouble cleaning his braces. What should he be doing to keep them clean? Always seems like they have things stuck. It's a battle every day.
The best advice I'd say if he's struggling with a toothbrush is invest in a water pick.
Okay.
The water pick will take a little bit for him to get the hang of it, and may look like he took a shower the first time he used it, but the water pick does a great job. It's a gentle stream of water, and it'll kind of debride all the areas.
Yeah.
So generally my recommendation would be is use the water pick first, get all the debris off, and then go back in and then brush with the fluoride toothpaste that you can get to those areas, and I think that they're going to see a huge improvement.
Angling the toothbrush underneath the brackets. That's the one spot I see a lot of kids missing. They get the top above the brackets fairly well, but below the brackets a lot of times, sometimes that's up front where the lip's a little tight there, but just focusing getting underneath the bracket, kind of half on the tooth, half on the gums there.
I would agree, between the bracket and the gum tissue is where we see that people struggle the most with, so that's where you want to spend a good portion of your time really concentrating on that area.
What happens if you don't keep it clean? What are the dangers of it?
Then what will happen is you're going to get, your tissues will become puffy and irritated, and they'll bleed. But then eventually what will happen is, like we talked about, the breakdown of the bacteria to acid, you'll start getting white spots that'll look almost like chalky white on your teeth. And that's the initial stages of a cavity. And once you get the chalky white spots, it's not too far in the future that the tooth is going to start to pit. We call it cavitate, but basically it's going to start to lose enamel, and you're going to start to get the, for lack of a better word, the holes in the teeth where they start to become cavities. So,
Okay.
And that's the number one thing I tell kids before they enter braces is because I see so many kids that get out of braces and they have basically white circles where all those brackets were. And I know that you guys are starting to put those brackets a little bit lower, which I think helps keep them clean a little bit nicer. And honestly, for me, long term, for those kids that do develop still a little bit of that, it's usually in a little less visible area as far as the decalcification goes.
And there's some options for patients too if they're really struggling with that. There is some generic prescription toothpastes that have the higher concentration of fluoride that we'll put people on too that seems to help. You know, generally it's not going to hurt anything if you use a stronger concentration. So if you feel your child's struggling a little bit with it, or you're seeing maybe a little bit of white spots, you know, just ask your dentist, orthodontist who's providing the orthodontic treatment if they would have a stronger toothpaste, and they can probably write you a prescription for a generic toothpaste.
Okay, wonderful, great information. Thank you both. Now, teeth whitening is a cosmetic dental treatment that brightens smiles by removing stains and discoloration. Dr. Bradley Jordan, a dentist at Lone Oak Dental in Brookings, spoke to Prairie Doc about the treatment.
I like to think of teeth as like a white t-shirt. So anything that's going to stain a white t-shirt is going to stain your teeth. So you've got soda, you've got coffee, tea, even like blueberries, ketchup, red wine, that kind of stuff.
Jordan says there are multiple methods of teeth whitening.
There are professional, like in-office whitening. There is professional at-home whitening, and there's also over-the-counter products like pens, gels, toothpaste, mouth rinses, those kind of things.
He says professional teeth whiteners protect the gums more than over-the-counter products.
So we make custom trays that sit just on the teeth, prevent the chemicals from getting on your gums, from making the gums sensitive.
Jordan says that when deciding on a whitening treatment, you should keep 3 things in mind.
What are your goals? What's your budget? What's your timeline? If your goals are to have like the Hollywood smile, we're going to have to start thinking about straightening your teeth, whitening, and then probably veneers. If you just want to get a couple shades lighter, then you probably can do the at-home like white strips. You can do the professional whitening at home. What's your budget? If you can only spend $50 to $100, I would say that the at-home strips will probably work okay, or some of the gels. What's your timeline too? Like if you have a wedding in 2 weeks to be at, you're probably going to have to use just the at-home stuff. It's pretty hard for a dentist to whip out trays in a couple weeks. But if you've got a long period of time to whiten your teeth and get the perfect smile, you could do straightening, whitening, and then veneers to get that perfect Hollywood smile.
Now, why do certain people achieve whiter or brighter teeth than others? I think this is a pretty common question when folks are wanting to whiten their teeth.
Yeah, go ahead. You can take it.
All right. So a lot of it, some people just as far as their thickness of the tooth, thickness of the enamel, translucency, usually as we age, teeth calcify a little bit in the middle too. That's why when you see a young kid, the nerve inside the tooth is really big. As they age, it really tightens. So the older we get, usually those teeth are going to yellow a little bit over time.
Absolutely. And just like you said too, I mean, diet will play. If you're a coffee drinker that drinks a few cups a day, it's going to be a lot harder to get your teeth to that Hollywood white, to say, because you are going to get some stains on there.
There is actually a follow-up question that I was going to ask from Facebook. The viewer says, is it okay to do teeth whitening with over-the-counter treatments, or what is the difference between over-the-counter treatments and treatments that can be done in an office?
Well, the over-the-counter treatments may not be as strong, so you may not get as significant of a change. And the other thing you got to be careful with the over-the-counter treatments too is that, you know, it's made for the tooth, but it's really hard to keep it off the gum tissue, and it can cause some irritations, maybe even a little bit of a burn on the gum tissue if you get it on there. Generally speaking, when you go to an office to have your teeth bleached, they're going to isolate it and protect the tissue.
Okay. This is a good question. We discussed this a little bit earlier, just about some of the different devices that can be worn, but this question is from email. It says, ever since I got my wisdom teeth out, my jaw clicks on the left side, and if I don't let it click, my jaw actually locks. Why is that, and what can be done about it?
That's a tough one.
Yeah, I would say more than likely the reason your jaw clicks and that it's catching is you probably have a little bit of what we call a disc displacement. And what the disc is, if you could picture maybe like a little shock absorber that sits between the lower jaw and the joint, and it uses to cushion it as you move. Well, if that gets displaced in a forward position, as you open and close, sometimes the jaw can get stuck on that disc, and that's why sometimes you can't open, or sometimes you may get that loud click or pop as it's going on and off the disc. As far as anything you can do for it, generally speaking, you're not going to do a whole lot to try to recapture. I mean, they have done surgeries to try to recapture the position of the disc, but I would recommend maybe going to a bruxism appliance. I'd be curious to see if the patient chews gum. I tell all my patients that have any discomfort in the jaws at all, you need to be done with gum. Okay. That is so hard on the jaws. And then maybe a softer diet. Fortunately, over time, a lot of times we'll see that may improve a little bit as the disc starts to become a little bit more fibrous and thin.
Okay.
The catch and the click may become a little bit less, but it'll be a process.
Any surgical options?
There are some surgical options. They can do a disc repositioning surgery.
Okay.
Where they do that, and sometimes they can hold it in place with temporary pins. But the problem is once the disc has been displaced or stretched, I could do everything and put your disc back where it should be, but you could go to sleep that night and sleep on it wrong, and the disc could move back. So the hard part is to keep it in that position.
Sure.
So that's the rub right there, where you start trying to reposition a disc is keeping it without it sliding again.
Yeah.
Yeah, I think a lot of it's gone from surgeries to trying to treat symptoms.
Absolutely.
A little bit
Yep.
in the TMJ.
From an email question, could the doctors talk about TMJ and how to make the pain go away even faster if you do have a device? This patient or this viewer says, once I have an issue, it takes at least a week to feel better.
I like putting heat on that joint to get some more blood flow there. You can use a little ibuprofen. Limiting opening really big, I think, is a big thing.
Yeah, I would soften your diet. As I said before, eliminate all gum. It depends on, I would try to do a little bit of behavioral modification. Try to check yourself during the day. You know, sometimes we don't even have to really brux our teeth together, but if we're clenching our jaw during the day at work or when we're concentrating, that can load the joint too and cause it. So you need to take some of the stress off that joint.
Okay.
You know, sometimes you'll see that TMJ can be triggered by if we know we have a stressful week or something like that. We all have that, and we tend to clench or brux a little bit more. So it's multifactorial. But if you do have TMJ symptoms, I definitely would recommend that you see somebody to be evaluated. The majority of TMJ is going to be due to what we call parafunctional activity, and that's clenching and grinding.
Okay.
The muscles just don't like that, the teeth don't like that, and something's going to give, and usually it's the muscles, and what happens is they become inflamed. And so now it's going to limit your opening, it's going to hurt when you chew and eat, and sometimes, you know, probably for those, probably about 80% of the time, if you can get a good oral appliance in that you sleep with, you know, within a few months, about 80% of the time, you're going to see some relief.
Any risk factors or certain groups that are more affected than others with TMJ?
Females.
Women, yeah.
Okay.
Yeah.
Usually, I see it in our office. Usually we'll see it late adolescence, 15, 16 is when it may start. The good news is usually, you know, some can have it severe, but usually it'll improve over age. We don't see a lot of 55, 50-year-old people with TMJ. It's usually that young adolescent to middle age is when we see most of the symptoms, and a lot of times you can do some things to make it at least comfortable and try to get them out of pain.
Yep.
We probably are never going to get rid of a click in the jaw, and we don't try to, but we just want to try to get people comfortable.
Yeah,
And
absolutely.
a lot of our patients that are women that are a little bit older than that, I would say the majority of it's clenching. And they know they clench during the day. It's just one of those subconscious things that they get busy, they get stressed, they lock down. So it's just trying to really focus on being
Absolutely.
aware of it.
Yeah, I would say that probably is the biggest culprit.
Try to find some way to reduce the stress if
Which
they're
is-
facing it, which
Yeah.
we all
If I
face.
had the answer for that.
Right. Yeah, I wish I had something
I
for
agree.
them.
I agree. A caller from Sanborn, Iowa is asking, are dentures supposed to last a lifetime, or do you need to continuously have checkups on dentures?
I would continue to have checkups. So, like I said earlier, insurance usually pays every 5 years. A lot of it depends, did you get the teeth out at the same time as the denture was made? Obviously, that bone changes the rest of your life. Those first 4 to 6 months, the majority of that healing happens, but it always changes. So no, dentures do not last forever. I mean, some of it depends, I guess, when you have dentures or get dentures, but I would say every 10, 15 years, I would say, for somebody that's not a same-day denture. The other thing you want to check is the gums, make sure there's no oral cancer going on. I know in dental school we had a couple cases where patients had dentures, and the only reason they came in was because the denture wasn't fitting right, and they ended up having oral cancer. So.
Those checkups are still important
Yeah.
with dentures as well. This is from an email question. I have a small space in the back of my teeth after my wisdom teeth were taken out that food gets caught in, and it irritates my gum and causes pain. What can I do about that pain and irritation? I do floss the area and it still gets irritated.
It's a tough one. So sometimes, just depending on the positioning of that wisdom tooth, there can be a little concavity there, kind of on that back side of that back tooth. Sometimes, honestly, just getting a little bleeding in that area can get those fibers to kind of tighten up a little bit. But yeah, it's a tough area.
It is. I would probably just discuss that with your dentist,
Yeah.
and they can do some things. I mean, if it's a big space, you could probably slide the teeth together with a clear retainer that would maybe take a month or two. So
Okay.
there's some options, but I think anything like that, I would just visit with your dentist
Yeah.
and let them know that you're having some problems.
So this is not on the list from our viewers, but it's just a question that I have, and it is about dental implants. If we lose a tooth for any number of reasons, one of our tooth replacement options is a dental implant. Like dentures, are dental implants a lifetime device in our mouth, or do we need to continue to have those checked as well?
They can be a lifetime, but I think some of the stuff online is that they last forever. There's certain cases that they definitely can last forever, but there's certain cases where they don't last forever. Some of that's dealing with the amount of bone that was available a lot of times. Home care, keeping dentures clean, but definitely still want to have regular recalls.
Yeah, I was just going to say, if you're hoping to keep an implant for a lifetime, it's going to come down to home care and still seeing the dentist on a regular basis.
Can you still have orthodontic care if you have a crown, a bridge, an implant? How
Yes.
does that work? How does that coincide?
You can still have orthodontics, but if you have a bridge or you have an implant, we really can't move those areas. So a lot of times what we end up doing is having to work around those areas. So if somebody would come in with an implant, then what I would have to do is make a treatment plan to line everything else up, but leave the implant where it's at and try to work around it.
Okay. This is a good question. It's from email. I have not been to the dentist in years, but now I have dental insurance. Is this appointment going to be longer, and should I disclose it to my dental care team how long it's been since my last appointment?
So one of our questions on our forms asks, when was the last time you were at a dentist? It is nice to know, just as far as sometimes those people that haven't been in as long will have more tartar, calculus, build up, whatever you want to call it, on their teeth, where it might take that cleaning a little bit longer.
Sure.
Sometimes on those people, even we'll have them come back a second time, kind of do a general debridement that first visit, then go in and fine clean the second one.
Okay. The next question is regarding veneers. It's from an email question. Could the doctors talk about the process of getting veneers? Is it painful, and how long do those last?
So there's different types of veneers. I mean, there's no drill veneers. A lot of that's just case by case dependent. A veneer is the best way for me to describe it is it's basically half a crown. Usually you don't have to prep quite as much. A lot of it's positioning of the teeth as well. I mean, it's not a one fit for everybody.
Yeah.
It's a little bit different for everybody. Should not be painful. I mean, you usually will numb it for the cases, but usually you just have to take out the visible part of the tooth, kind of take that down a little bit so you have that space for that veneer to see down there.
Yeah, I would say it's not painful. I myself have veneers if my upper front 6 teeth are veneers.
Okay.
So
They're beautiful.
I've had them since 2004.
Okay.
Goes back again. It's you know, take care of them, home care.
Yeah.
You know, don't chew ice. Don't open bottles with your teeth. I mean, just the common sense things if you want them to last. But yeah, it was painless, and it was easy, and been very happy with them.
Okay. One thing we haven't talked about yet is flossing. We talked a little bit about the water pick with braces, which can be useful as well in general dentistry, just for patients that don't have braces. But why, a question from email says, why is it important to floss? Can I just use mouthwash instead?
No, no. I would not recommend it. So what we always tell our patients is toothbrushing and flossing's the key. Mouth rinse, it's an additive thing. If you want to do it, it might help a little bit. Yeah. But the big thing is just debriding that portion of the tooth that toothbrush is a little bit too big to get into. Yeah. As far as what type of floss, on our boys we use floss picks. I use floss picks a lot of times. It doesn't have to be the old floss. Anything that really gets in there to debride that area. Water pick does help with some of that stuff too.
No, I agree.
This question is from Facebook. Why do we even have wisdom teeth, and are they always removed?
Boy, I probably let you address that one since you take
the why. I don't know why they. I mean, that's just how we were made.
That we have.
Yeah.
Do we always take them out? Not always. Some people lose molars earlier, so sometimes we'll shift that wisdom tooth into that, which is an orthodontic thing sometimes, but majority of the time we're probably taking out wisdom teeth. A lot of that's due to spacing. Yeah. Honestly, even with people that have decent spacing, I usually recommend taking them out, and that's more so just long term. Okay. As people age, their dexterity as far as keeping that area clean so far back, people almost always tend to get cavities, and the younger you are when you get them out, you just heal so much better.
What is the average age that someone would get their wisdom teeth removed if it's?
I would say 15 to 21, 22 is when we usually see it. Girls usually are a little bit towards the earlier age. Boys tend to be a little bit later.
Okay. A caller from Rapid City asks, a tooth root was reabsorbed, but there's no pain when chewing. What does a procedure for this condition look like? So if you have a patient walk in that a tooth root was reabsorbed.
Or was resorbed? I have a couple of people that have the same thing where there's resorbing. Majority of the time we kind of let stuff ride as long as it can. We just haven't run into like big infections off of those teeth. Yep. It's just basically where that bone's eating away at the tooth. At some point, those patients will probably lose that tooth, and then you're looking at an implant or a bridge, some type of replacement.
Right. Yeah, we see that in orthodontics. You know, about 3% of the cases we'll see root resorption due to one reason or the other when we move teeth, and a lot of times we just monitor them and just keep them as long as you can. You just be careful with the tooth if you're biting into anything, but I don't really do anything with them unless they're causing a significant problem.
And there's different types of resorption. There's external, internal resorption. Yeah. I won't go too far into that, but sometimes endodontics, root canals can help with that too.
All right, wonderful information. Thank you both. We will be back after this.
My name is Dr. Tom Dean, and I serve on the Healing Words Foundation Board, the nonprofit organization that runs Prairie Doc programming. Our mission is to enhance health and diminish suffering by communicating useful, science-based information respectfully and compassionately. Your donation supporting Prairie Doc programming makes an extraordinary difference. Gifts of any size enhance its impact in our state and beyond.
Don't miss out on the latest insights into health and wellness. Be sure to pick up a copy of your local newspaper or explore the Prairie Doc Perspective online, a weekly column dedicated to providing valuable information on health and medical topics. Access all previously published columns and stay informed by visiting www.prairiedoc.org.
finish up this evening's discussion, I want to thank Dr. Hilbrands and Dr. VanLaecken for sharing their expertise with our viewers. And thank you to all of our viewers for tuning in tonight. We appreciate your continued support of our mission, providing science-based health education. Don't forget to follow us on Facebook, Instagram, YouTube, and TikTok for more information and updates. And if you missed sending in a question tonight or it didn't align with our topic, send your questions to ask@prairiedoc.org to be answered on our weekly radio program, Prairie Doc Radio, Sundays at 6 a.m. and 1 p.m. on SDPB Radio. And be sure to download and subscribe to the podcast version of this show and the Prairie Doc Radio podcast wherever podcasts can be found. Thank you for joining us for another On Call with the Prairie Doc. Until next time, stay healthy out there, people.
Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you with care and coverage. Hello possibility. Hello healthy. Hello life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Sanford Health, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health,